Hello, my name is Quentin. I'm a student physical therapist at UNLV, and you are Susie, correct?
Yeah.
Okay. So I did see that you were recently in a car accident, and you kind of have some neck pain and some headaches that are kind of intermittent throughout the day. So can you just kind of tell me more about the car accident?
Yeah. So I was in a car accident. They rear-ended me. We were at a stoplight, and they were going pretty fast. Rear-ended me, and my whole body kind of jolted forward, and then I slammed and hit my head on the headrest. And since then, yeah, I've had pretty severe neck pain.
Okay. Was the pain pretty sudden, or did it gradually come on?
It was pretty sudden.
It was sudden. Okay. And then I did see that you had an X-ray. Actually, let's go back. Did you have any radiating pain? Anything that radiates anywhere? No.
No, it just kind of stays in this back area.
Okay, and it's on both sides, one side?
It's kind of all over, I would say.
All over, so kind of,
Yeah.
Okay, so does it kind of here and then it comes down in here?
A little bit.
A little bit
Maybe,
on
yeah.
both sides. Okay. So, and then I also did see that you had an X-ray. Did the X-ray show anything?
No.
Okay. What about, any other imaging done? You can just come by. Okay, so no X-ray imaging done, or no other imaging done?
No.
Okay. And then, so I also see that it does affect your sleep. Is it certain positions that you're in? Or?
Yeah. I usually sleep on my back, and I just cannot get comfortable.
Okay.
I think that's my problem, is I can't get comfortable because the pain is pretty so severe right now that I just feel like I can't even fall asleep.
So what about on your side? If you have any bent neck, because sometimes feeling on your side can be bent, does that also irritate it?
I have found that if I get a lot of pillows to support me,
Yeah.
I can fall asleep better, but it is pretty uncomfortable.
Okay. Let's see. So, is there any other positions that you notice the pain, throughout your daily life? I know you're you work at a casino, right?
Yeah.
Have you worked since you've had the injury?
I try to, but it's so hard.
Okay.
Because I'm standing all day. I'm a dealer.
Yeah.
So I do feel that position, standing there all day with my arms in front of me and working has been pretty terrible.
Okay.
Yeah.
So is it more so that position? Are you kind of hunched over, leaning forward when you're dealing? Do you notice?
Probably. I mean, I probably don't have the best posture, but.
Okay, that's fine.
Yeah.
Do you experience any? So I saw you had muscle spasms. Are those also kind of more at work or in those positions? Are they ever at rest?
Not really at rest, but when I'm doing activities, yeah.
Okay. All right. A few more questions here. So just to check, you don't experience any dizziness, nausea, or any of those types of symptoms?
No.
With anything? Okay. Perfect. And then last thing, I did see you're taking Soma and ibuprofen, 800 milligrams. Is that correct?
Yeah.
Okay. And does that seem to help with the symptoms?
In the short term, yeah, it helps for a couple, maybe 2 or 3 hours.
Okay.
But after that, it comes right back.
Gotcha. Okay. Well, so since we kind of got the questions out of the way, I kind of have some ideas, some tests I want to do.
Okay.
So I will have to be hands-on. As long as that's okay with you, then we can go ahead and get started with that.
Yeah.
So, okay, first thing I'll do is I'm just going to take your vitals.
Okay.
Vitals are good. So what I want to do first is I'm just going to kind of have you move your hair for me here. And then, good. Actually, go ahead and, is this normally how you sit? Sitting position, posture-wise?
I feel yeah.
Okay. So what I'm going to do here is I'm just going to kind of feel around on your neck, and what I'm going to do is I'm going to kind of go down as I press here. I'm going to top your head.
Okay.
As I press, I want you to just tell me if there's any pain. So is there any pain here?
No.
No? About here?
Kind of, yeah.
Kind of there? Okay. Keep going down.
Yeah.
Seems tender down here, which is kind of helping me out. And I'm going to go ahead and grab kind of the side here, same thing, and tender up here, pain.
Yeah.
Yeah. Okay. And as I go down, does it seem to kind of get better?
Yeah.
Okay. All right. A couple more things here. I just want to kind of feel the musculature. Definitely feels a little tense.
Yeah.
Does this kind of, is this bringing on any headaches or anything as I'm pressing, or any tension in the head?
Kind of when you were poking up here,
Okay.
that did make things a little worse. But down there, I think it's just tender.
Okay.
But I wouldn't say it's making anything like worse, other than like the first poking.
Okay. All right. So now I just want you to go ahead and actually stand up for me.
Okay.
And just make sure you kind of stand nice straight for me. All I'm going to have you do is we're just going to do some neck movements here. So I just want you to first bend forward for me as much as you can. Okay, good. Is it pain with that?
Yeah.
Okay. Just going to come back up and relax there. Now we're going to go backwards when you're ready. Same thing. Let me know if there's pain.
Yeah.
Okay. All right. And now we're going to go to the left. Oh, yeah.
Yeah.
Okay. Now we'll go to the right. Oh, yeah. Definitely pain.
Yeah.
All right. Now we'll just do turning to the left.
Ooh, that doesn't feel good.
Okay. Now to the right. All right. So go ahead and have a seat. So what I'm going to do now is I just want to kind of get some range of motion here. So I'm going to use these guys, and I'm just going to kind of direct you here with what we're doing. So let me kind of move your hair for me again. Okay. So first thing, you just kind of look forward for me. Make sure your seat is nice and straight. You got prominent T1 here. Okay, so what I'm going to have you do now is you're just going to kind of bend your head down as much as you can for me.
So it's pretty painful, like right there.
Oh, yeah. Okay, so go ahead and relax there, and I'm just actually stay down for me as much as you can, sorry. And I'm just going to try to push it a little bit more. Up there, okay. And then we'll go ahead and relax for a second, take a deep breath, and then we're going to go backwards here. Okay, and then push a little more. Okay. So, yeah, definitely limited both those directions. I have a couple more. Are you doing okay?
Yeah.
Okay. So now, I have the same setup here, except now what I'm going to have you do is you're going to make sure your seat up nice and straight still for me. Good. And then I'm going to have you bend to the left as much as you can. Good, good. I'm going to push a little more. Okay. Is that painful?
Mm-hmm.
Okay, go ahead and come back up, relax for a second. And then when you're ready, we're going to go ahead and go to the right. Push a little more. Got a little more on this side. Okay, go ahead and come back. Okay, so, yes, definitely limited there in those ranges of motion, so that's definitely something we can handle on when we get to it. Let's go ahead. I'm going to have you stay seated for me. And I'm just going to test some of your muscle strength here. So the first thing I want you to do, have you look at me real quick. So you're just going to have your shoulders nice and relaxed, and then I'm going to have you lift your shoulders.
Okay.
So go ahead and do that for me. Good, good, good. All right. And then now what I want you to do is hold that, and I'm going to press down. I want you to resist me pressing down.
Okay.
So here we go. 3, 2, 1. Good. Go ahead and relax there. So good strength there. Now let's do. Okay, so we're good there, seated. Now what I'm going to have you do is actually go ahead and lay on your back for me here. So I got one more range of motion here. So what I'm going to do is I'm going to have you go ahead and lift up your head for me. So get under here. Okay, good there. And then all I want you to do is you're just going to try to rotate your head to the left for me as much as you can. Okay, try okay?
That's painful.
Come back a little bit. Alright, rotate.
Yeah,
Okay.
that's painful.
The other way. Does it feel stiff?
Yeah.
Definitely feel a little bit of stop there. Okay. Relax. So yeah, in there, definitely some range of motion limitations.
Okay.
So what we're going to do next is I'm going to test some more strength, mostly kind of in the neck muscles and the flexors here.
Okay.
So what I'm going to have you do, yeah, perfect, you can just stretch your arms there. And I'm just going to have you lift up your head like so. So you're going to bring your head up. Good. And then when I have you do that yourself, you're going to hold it there. So go ahead and do that. Hold it. Good. Does that feel okay?
Yeah.
Okay, so now I'm going to press down. I want you to resist me here.
Okay.
So 3, 2, 1. Oh, yeah. Okay. Definitely some weakness there, but that's okay. All right, so now what I'll have you do is we're going to do lateral flexion. So I'm going to have you go ahead and turn towards me first. Good, good, good. And then you're going to lift up like so. And you're going to hold that when you do it yourself, okay? And then we'll do the same thing. I'm going to press down. I want you to resist.
Okay.
As long as it's isn't painful when you lift.
Okay.
So go ahead when you're ready. Does that feel okay?
I think I can do it.
Okay. I'm going to go ahead and press here. 3, 2, 1. Okay. Go ahead and relax. It's okay. All right. Now we're going to go ahead and do the other way.
Okay.
When you're ready, you're going to come around this side. Okay. So same thing. It's going to go to the right for me. Good, good. Go ahead and lift up. All right. I'm going to press down. 3, 2, 1. Okay. Yeah. Go ahead and relax. You can go ahead and find that comfortable position where your neck can be too. And we got one more here for the neck. Are you doing okay?
Yeah.
Okay. So this next one is kind of a little tricky. So what I'm gonna have you do is basically you're gonna bring, I'm gonna kind of touch your face here.
Okay.
You're gonna bring your chin in towards your neck like so. Good. And then I'm gonna have you lift your head up to about here. Good. And I'm gonna move my hands and I want you to hold this position as long as you can.
Okay.
And I'm gonna time it. So 3, 2, 1. Good. As long as you can, whenever you feel you need to, just go ahead and relax. Okay. So you got about, I would say, 15 seconds there. Normal's about 38 seconds. So there's some weakness in there. So your endurance, that means like your endurance is a little lacking, which is okay. It's just something we can definitely work on. And then last couple tests here. I'm gonna have you flip onto your stomach. And when I say last couple tests, I mean muscle tests. We still have a few more after this. Okay, so this one, yeah, wherever your arms feel comfortable. If you can, bring them by your side. There you go, good. And so for this one, what I'm going to have you do is you're going to bring your head up like so. Good, trying to look up there. And you're going to hold it when you do it yourself. So go ahead and relax down. And when you're ready, I'll have you do that. Pretty good. Now I'm going to press down. I want you to resist as you can. 3, 2, 1. Oh. It's alright. Okay. So, one more here. What I'm going to have you do, you're going to bring this arm out, like so. You're going to bring it here, and then you're going to lift up your arm like this, and I want you to hold that. Okay? So, 1 second, go ahead and relax. I'm going to get to the other side here. Okay, so when you're ready, go ahead and do that. Hold it there. Make sure you're here. Good, good. Hold that. I'm going to press here. I want you to hold. 3, 2, 1. Good, good. Good. Then relax. Now we're going to do the same thing on this side. Hold it, hold it. 3, 2, 1. Good. And relax. You can go ahead and sit up. You got it. 4 more tests I want to do here. So overall, your shoulder strength was good. Neck strength is definitely lacking.
Yep.
So we can definitely work on that. So now what I'm going to have you do is move your hair for me again. Good. And the first thing we're going to do. Okay, so what I want you to do is I'm Just let me know if it's too much pain. Okay, here we go. Is that painful?
A little bit.
It definitely feels a little loose up here.
Yeah.
Go ahead, relax, bring your head up. Just go ahead. Around here. Okay, so now what I want you to do is I'm going to grab your head, but you go ahead and relax.
Okay.
And I'm going to bring you to the side. I got a little loose there.
Yeah.
Come around here. Okay, let's do that one more time here. Painful?
Mhm.
Okay.
Yeah.
Okay. The next, what I'm going to have you do is you're just going to bend your head to the side for me, rotate, and then kind of look up towards the ceiling. Does that cause any pain?
Yeah.
Yes, okay. So go ahead and let's do the other side. So again, bend to the side, turn, rotate same way, and now look up towards the ceiling. Pain?
Yeah.
Okay. Go ahead, relax. And we got, that's good. So after all that, I'm leaning towards whiplash is kind of the best way to put it. So whiplash is an injury that commonly occurs, especially with accidents. So there you have ligaments in this area especially that can get irritated when you kind of fling forward and fling back. So what I would ask of you is to definitely on your own kind of start moving your neck more and try not to like be too what's the right word? I guess cautious with your movements. Like do what you can, but definitely don't try to like guard and not move because that'll just make it worse. And we want to keep that movement as much as we can. I did notice a little bit of looseness in your upper cervical area here or your upper neck.
Okay.
So that's kind of telling me that those ligaments are a little bit loose is the best way to put it. So one thing I would like to do is to start doing some strengthening exercises to kind of help strengthen that area as well as kind of maybe some proper posture mechanics just to kind of help with putting your
Get me back up straight.
yes, putting you in the right position. And then other things too, like for pain levels and stuff, if you're ever feeling like the inflammation in your neck or anything, ice can help kind of relax that, so that burning feeling can definitely calm that. And then in the mornings, I did read that you do have stiffness in the mornings, so one thing you can do is add heat to that.
Okay.
And that'll help kind of warm up the tissue, warm up those ligaments so that you have it feel a little looser before you start with your day.
Okay.
Some final things, one thing I want to do is definitely give you some strengthening exercises to take home with you. So a home exercise program, also some stretches says you were a little tight in your trapezius, in your muscles here.
Okay.
So I want to give you some stretches to kind of help with that, and the strengthening also, like I said, help with stabilizing those ligaments.
Okay.
So if that all sounds good to you, we can go ahead and get started.
Yeah. Thank you.